with OTEL Talk, and today we have Dr. Greg Hammer. He is with Stanford University Medical Center. And Dr. Hammer, you have quite an impressive background in medicine, pharmacology, immunology. You're also a world-renowned speaker. And so I want to find out first, what caused you to want to become a doctor? And what's been your most satisfying part of your career?
Good morning, Eileen. So nice to be with you. How I decided to go to medical school and become a doctor. I was an undergraduate and I was studying astronomy, among other things. And I came to appreciate the interrelatedness of everything in the universe. And I saw the human body and human biology as a model for that. So when I came to a bit of a fork in the road as to how to proceed with my career, I decided that medicine would be a bit more practical, say, than astronomy, and that I could help people, and it would be a very rewarding career. So I decided sort of mid-university, I suppose, that I wanted to be a physician. And it's been wonderful. I've never looked back. It's just been a fantastic career.
So it sounds like with the astronomy interest that you see the interrelation of pretty much everything in life, and you've had a long career. So in your years of practice, things have changed over time, and what's going on today in the world is totally different than when you started your practice. What do you think has contributed to those changes, and how that has impacted doctors and people in the medical field today, aside from the COVID of what's going on in the moment, but just in general in the practice of medicine?
That's a great question, Eileen. So many things have changed. One of the most dramatic areas, I guess, has been the explosion of technology. I think people can appreciate what's happened with computing, for example, and how things have just exploded compared to where they were 20 or 30 years ago. The things that we can hold in the palm of our hand now compared to what occupied a large room not even that many years ago. In medicine, there's been just a tremendous advance in technology. And as a result, things have become quite a bit more expensive, for one thing. And so the cost of delivering care has gone up and up and up. And that's one thing that has driven changes in medicine that have created a lot of stress for physicians. The constant pressure to do more with less, the shrinking pot, if you will, even though I know that healthcare costs in the United States are a large percentage of gross national product compared to other countries. But this explosion in technology has led to greater cost in medicine, and also survival, gladly, of so many people with complex disease. And so our population is aging, and that's another stressor for physicians, is that our patients are becoming sicker, more complex. So those are areas that have changed, that have created a lot of stress for physicians. Obviously, there have been, those are a double-edged sword, certainly. I mean, it's great that people are living longer, and it's great that technology has advanced to the extent that it has. Things are available, elements of caring for patients are available that were not available even a short time ago. Those are some of the changes. And again, those have created stress because the economic models have changed. There are a lot more metrics to measure what we call quality in medicine. And again, physicians feel the heat from that as well. And so this has created an increase in burnout among physicians, whereby more than half of physicians who are practicing exhibit signs of burnout. Mm-hmm. Physician suicide is one manifestation. There's more than one physician suicide every day.
Really?
So I think this has actually spurred an interest in in a new area in medicine among organizations, university medical centers, hospitals, clinics have started to develop wellness programs for physicians. And Stanford was really on the cutting edge, and I think remains so, with our Well MD program. And I joined that, and that, along with the growing need, I think, for tools to help us be more resilient and happy in our practice, really led me to start focusing on wellness in my lectures and speaking engagements, and also led to my interest in writing this book, Gain Without Pain.
Yes,
so those are some of the changes.
Well, it's a common occurrence just in life in general, and I can see in the medical community, it's kind of a dichotomy because you have all these advancements, but at the same time, there's a lot of pressure and there's a lot of things that come along with it that hasn't necessarily been looked at in the way it needs to preserve the sanity and the health of the physicians themselves, the nurses, anybody in the health community. What is your philosophy about the symptoms? Because your book, which we'll get to in a little bit, but your book has like tools, and it's all about how people, especially those in the medical community, can withstand all those pressures and the stress. So share with us a little bit about your philosophy of the gain without pain.
Sure. I would say, just kind of getting a bird's eye view, there are three categories of drivers and potential cures for burnout among healthcare providers. Again, it's not just physicians. And they include the culture of medicine, whereby historically the patient always comes first, and that's a noble directive. On the other hand, that comes in many cases at the expense of the physicians taking care of themselves. Simple things, working through lunch, not taking bio breaks, not staying hydrated, working into the night, bringing work home. So the culture of medicine, I think, needs to shift back toward more self-care for physicians, because if we're burned out and we don't take care of ourselves, we don't take care of our patients as well either. And there are a lot of data to support that. A second category of drivers of burnout and potential directions for ameliorating the situation is really practice inefficiency. And I think this economic pressure has led to, for example, those who work in clinics being asked by their administration to see more patients per hour. And that has led to greater waiting times for patients, because those physicians don't have the infrastructure. They don't have enough exam rooms. They don't have enough staff. So patients are waiting longer and spending less time with their physicians, and that's leading to patient frustration. And that comes through in patient satisfaction scores. And again, I talked about metrics. So physicians are being told that they need to improve their patient satisfaction scores. But the reason that the patients are dissatisfied has nothing to do with the care rendered by the physician. So it's out of their control. And the third area where we can identify drivers and cures is resilience. And these three are really all interrelated. I don't think that we can make great progress in healthcare worker wellness without addressing the culture, practice inefficiencies, and resilience. But resilience is the arena in which I think that I saw my own role. I'm not an administrator. I can't really address the other problems, but I can address the problem of resilience. And I've had a long-standing wellness practice myself in terms of fitness and spiritual practice. And so this is really where I saw my role and my opportunity to be a part of the solution in the area of resilience. And that's what sparked the interest in writing this book. And I have seen that there are really 4 pillars of resilience, and those are expressed by the acronym GAIN. And namely, they are gratitude, acceptance, intention, and non-judgment. And those are all interrelated, but I think they really are the pillars of resilience and happiness.
Absolutely. And, when I read your book, I read your own personal stories throughout the book. and we're all human, and we all have our own personal journeys. And I think sometimes people forget that those in the medical profession are humans as well, and they do have those stressors that can cause the four pillars that you just talked about to either, if they implement their own program for themselves to make sure that that is a part of their daily life, then they can be a better doctor or nurse or anybody in the medical community, regardless of all those pressures and the stress. And it sounds like your culture of wellness that you want to bring into the hospital is really to educate those that are running those programs with all those metrics to understand that part of it that you've written about in your book. So what are your plans for continuing to educate people, the general public, the doctors, the nurses, the medical professionals, and those that are dictating, how things should be operated, because they all work together? How do you plan to move forward? And now that we're coming out of COVID and moving into a new way of being, it seems like what you're onto here is like opportune for what we're heading into now. So how do you plan to bring this forth in more expansive ways to make that shift and help be that change? And what I'd like to say is a pioneer in creating that change in the hospital and a trailblazer.
Well, thank you. First of all, that's the reason that I wrote the book. And so I hope to spread that message through the book. Prior to the sheltering in place related to the pandemic, I was invited, I think, with greater frequency to speak around the United States and around the world about wellness, among other things. So if I'm invited to a meeting to talk about my research, for example, or topics in pediatric intensive care medicine and pediatric anesthesiology, I always have a lecture on wellness as part of that meeting. And so, in fact, I had to cancel lectures on wellness in San Diego, in Boston, in Japan, Brazil, and Prague, just in the few-month period during the pandemic and in the next couple of months. So I hope that I can continue to do what I'm doing and spread the message through the book and through online opportunities like this one. Thank you so much for that.
You're welcome.
And we'll see. I have no expectations. I think it's best to live life in the present moment. That's part of the message in the book, is how to be present, how to be mindful. We do need to think of the future so that we can plan and look forward to good things, but we don't want to look into the future in ways that represent fear and anxiety and catastrophizing, which we tend to do. So I just plan to be present with the message, if you will, and we'll see where it goes, one day at a time.
Exactly. So I had a thought while you were talking. Have you seen any results of what you've been sharing so far, where someone or more than one person has taken your information and applied it to their life and reported back to you that it's helped them in any way? Can you share an example of that?
Well, I can say that from my trainees, the medical students, residents, and fellows that fill out evaluations of me as a faculty member at Stanford, I've had a lot of good feedback. Those that have participated in, for example, a 10-week online course that I did recently. So I see evidence of that in my evaluations, in the response to the online course. And now the book has only been out as a paperback edition for a few days, and I guess as an ebook for a little over a week. And so far, the feedback I'm getting from that has been very positive also. So I've had a lot of, face-to-face feedback from people and feedback on evaluations and through texts. And, now through the book, I've had a lot of people reach out to me privately to tell me how much they appreciate it. I can also say that at the end of my talks, I do a brief gain meditation, which is a chapter in the book. It's kind of putting it all together in a practice, in a daily practice. And it's really so rewarding and remarkable to see a room full of hundreds of physicians, and I ask them all at the end to close their eyes, and we do this meditation and go to the breath, of course, I think, which is the foundation of most types of meditation and so essential, a tool that's always with us. Right. And then I go through the gratitude, acceptance, intention, non-judgment portions of the contemplation, and then back to the breath. And then I simply thank people and ask them to slowly open their eyes. And the response I've had to that has been quite remarkable and very rewarding, whereby the room is very quiet, and many people often come up to me at the end and just say that was an amazing talk and thank you so much. So I've had a lot of very positive feedback, and that definitely gives me the impetus to continue and carry on the message.
Absolutely. So in some ways, it sounds like you're empowering people to really take charge of themselves and learn how to manage the stress through the GAIN principles. So I just want to close out. Do you have any words of wisdom for people who may be struggling right now, doctors and people in the medical community, on just a quick tip that they could take away from today's talk with you, and then share with everybody where they can find you, where they can find the book, and how they can contact you to have you come and speak or give a workshop, and keep spreading the word and keep bringing the culture of wellness into society?
Well, Eileen, I think the message is, first of all, baby steps. Life itself is a process. And so let's not put too much pressure on ourselves to get where we know we should be too quickly. I think let's embrace a daily practice, baby steps. There's no such thing as failure. And then I would simply point to the elements of GAIN. And, we can start with gratitude. And one way to be grateful during this awful time is to look back 100 years ago on the influenza pandemic of 1918 and see how much worse things were and how much worse, therefore, they could be now. I mean, we have so many tools, such as the internet, through which you and I are communicating now, and by which we can stay in touch with family and loved ones. And, our medical care is so much better. There are so many fewer deaths now than there were in 1918. 50 million people died during that pandemic. And so let's be grateful for good medical care, the ability to be kept in touch with what's going on, and therefore take instruction regarding social distancing and other measures. So let's first be grateful for all the things that we have and not focus on what we don't have. And remember not to put too much pressure on ourselves. It's just small steps, hopefully embracing a daily practice that includes gratitude, acceptance, intention, and non-judgment.
That's a great tip. Thank you. So where can people find you and the book, and how can they contact you if they want you to come and share your message?
I have a website, which is greghammermd.com. It's lowercase, no punctuation, GREGHAMMERMD.com, greghammermd.com. The book is on Amazon. If you go to Amazon and just put in Gain Without Pain, Greg Hammer in the search window, I'm pretty sure that gets you to the page where the book is.
Thank you. And just an FYI for those listening and watching, we are going to continue our conversation with Dr. Hammer, and we're going to break down each chapter of his book in upcoming interviews. So we look forward to talking with you more and digging a little bit more into your thoughts and your insights. And it was really wonderful talking with you today. Thank you. And we will see everybody again soon.
Thank you, Eileen. It's really been a great pleasure to be with you, and I look forward to the next visit.
Okay, you're welcome.
Bye-bye.
Bye.